All right, so let's begin our discussion tonight. So we're going to be looking at gym steroids. Gym. These days, everybody goes to the gym. No, many people go to the gym, right? Many people go to the gym. Women go to the gym, men go to the gym. So we're going to look at gym steroids and fertility. How those steroids that they take or inject affect fertility, especially men that are interested in macho. Men want to build muscles. Women want to cut down fat, right? Everybody have an agenda. So, so we're going to look at the muscle fertility trade-off, right? Muscle fertility trade-off. What are you willing to let go? Fertility for muscle or muscle for fertility? So that's what we're going to be looking at, and I hope that we'll be able to convince some of our people, especially also women that love V chest. So it's not just to have V chest. It's whether the thing day, right? Good evening, Mata. Mata is here. Hello, Mata. How is your day? Good to see you. Right? So we're looking at muscle fertility trade-off. Now, this is the transformation that happens that nobody talks about. I tell you, if you don't like updates, you cannot be in this live stream, because we'll bring you updates and we'll also cast updates every time. Now consider a young man who loves going to the gym, right? He loves going to the gym. Why? He wants to build macho chest, V chest, biceps, six pack, right? Unlike some of us that have one pack, right? I have one pack and I'm very happy with my one pack. Very happy with my one pack. So you want to build V chest, biceps, and six pack. The results come fast. It does. The results come fast. The muscles will grow, right? And of course, with growing muscles comes confidence. Confidence increase. And the guy feels energetic. In fact, his energy is high. Everything is doing looks like success. Have you not seen those guys? They look they look confident, muscular, right? Everything looks like success to him. Until one day, or month, or year, a different question appears. And what is that question? Why are we not getting pregnant? Remember, this V-chested, biceps, six-pack guy is now married, right? And everybody that gets married is expected to have kids, right? Expected to have kids. So one day or years later, the question comes, why are we not getting pregnant? Why? You see, what many people don't realize is that some of this same substance, right, that are used for body muscle build, it builds your muscle quickly, and it can also cut down on natural fertility almost completely. Almost completely. Safina is here. Hello, Safina. Good to see you. So while your muscles is building pretty fast, big, six pack, your fertility is going down the drain to almost zero. To almost zero. So who is ready? Let's now dive deep into the gist. Let me give you the details. Who's ready for these details? If you're ready for these details, please talk to me in the comment section. Just type ready. Right? If you're just joining, you're welcome. Nana Afia is here. So first, before we go into the details, is that car Dr. Auto Mechanic is here. I see you. You are not late. You're just on time. Before we talk about the main gist, let's answer the question: what are gym steroids? So that everybody will be on the same page. Is that okay? What are gym steroids? When people talk about steroids in the gym, they are usually referring to anabolic-androgenic steroids. Right? Good evening, car Dr. Auto Mechanic. You're welcome. These steroids are synthetic versions of testosterone. Now, you know that testosterone is what makes man man. It's what helps man to build muscle. It is what helps man to knack, to have knacking ability. So John Thomas to jump up. Steroids! Testosterone. Now, when testosterone is built in the lab, that is steroid, and it is used for muscle building and all those things they do in the gym. So this synthetic version of testosterone, the reason why they design it is because they want to be able to increase muscle mass. So the next time you see somebody, have you seen what's his name, The Rock or Hulk Hogan or these latest people? I don't know their names. I don't watch those things anymore. Right? See those muscles? They are not naturally there. Right? They are overblown. Right? So this synthetic testosterone increase the muscle mass. John Cena, thank you. You are there. Thank you, John Cena. These are overblown muscles. It is from synthetic testosterone. Synthetic means it was created in the lab. Right? It increases muscle mass. It improves strength. Make no mistakes about it. It improves strength and enhances physical performance. You see them, they can lift cars. They can push boulders. Right? And the common example are either the ones they inject or the ones they swallow. These are injectable testosterone or oral testosterone derivatives that they are used outside medical supervision. Of course, it's not doctor that prescribe that for them, right? It is for their gymming activities, right? Now, this is where the core problem is. The core problem is not the testosterone inside of you. It is testosterone outside, external testosterone. And it's important you understand the concept. And here is the key concept, right? The body regulates testosterone through a very interesting signal. Don't worry about the system. But just know that the body normally produces it and regulates it. Our flash goal is about to go off. 3 roses. 3 roses is the flash goal. So 3 people drop a rose and that is done. Right? So the body regulates testosterone through feedback system. Right? Now, this system, if you were here before, I told you how that there is a coordination between the brain and the testes, right? If you forgot that one on your own. So this is how it normally works. the brain release a chemical, is a signal, right? Then there's a part of the brain that also releases, after getting that signal, it releases LH and FSH in men, right? Now that LH, FSH interacts with the testes to produce testosterone and sperm, right? Thank you very much for the roses. So all this system work in a balanced loop. That's how the body does it, right? So if you are here, please tap on your screen and share the live. So what then does, that is the natural system. So what then does steroids do? Steroids, what do they do? Because when external testosterone is introduced to the body, it has to do something. So what does it do? Who is ready for that question? Talk to me in the comment section. Type ready. I know you are there. Thank you very much. Blossom, thank you very much. One more rose to go. One more rose, and we are done with that flash goal. If you are not following me yet, I don't know what you're waiting for. You may not see me tomorrow, right? So what does steroids do? Thank you very much. Flash goal achieved. Hello, Mrs. Kamara. Good to see you. Thank God it's Friday. You're welcome. So we're talking about steroids, gym steroids. What do they do? Because these are external testosterone, was synthesized in the lab. So what do they do when it is introduced? When external testosterone is introduced, what does it do? The brain detects high testosterone levels, right? That's the first thing. The second thing is that it now assumes that the body has enough of testosterone, right? So because you are tricking the brain to think that there's too much testosterone, it shuts down its own signal. So you have tricked the brain, say, hey, brain, stop controlling us, we don't want you anymore, right? That's what you're doing when you are taking those steroids. Now, because you have successfully tricked the brain, what happens to your natural hormones? The LH and FSH reduces, and it will decrease stimulation to the testes. Remember, they are the ones that stimulate the testes to produce testosterone and sperm production. Now you have told the brain, shut up, we don't want you anymore. So what happens? All the process that leads to natural testosterone and sperm production is cut off. Can you see what you are doing to your body? Now what is the result? Sperm production begins to drop without proper hormone signal. Remember, it's from here down there. Now you've told the brain, get out of here, we don't want you, by introducing external testosterone. So without that proper hormonal signal, sperm production slows down dramatically or even stop completely. And of course, what happens? Well, you're either without sperm now. So in some cases, men who use these steroids may develop severe low sperm counts, what you call oligospermia, right? Or as azoospermia, as in there is no sperm at all. But they have V chests, they have biceps and what do you call it now? Six packs. But sperm production is no longer there. because they use external testosterone. They are anabolic injectables and oral things they take. They trick the brain to say we don't want those hormones anymore. Right? We don't want it anymore. So they begin to suffer oligospermia. I say, why is this guy so macho? So macho, but no sperm. Right? The next thing that happens, now you've shut down sperm production. The next thing that happens, testicular shrinkage begins. Bridget, I see you. You wait for your time to ask questions. Is that okay? Right? So that is another effect. Why? Because when there is reduced, when the testis is not performing its function of producing sperm, of course you've sacked all the staff. So what happens? There will be shutting down of the factory. So what happens? There will be testicular shrinkage. Testicle becomes shrunken. Now the reason is because testes are no longer active in their work of producing sperm, and cellular activities has died. So less activity means that you are going to shrink. You don't know what businesses do. Where there is no business, there will be shut down a factory. So the same thing happens. So you told the brain to stop producing hormones, and the hormones are no longer there. Sperm is not being produced, so the testicle begin to shrink. Right? This is not cosmetic. It is not cosmetic. It reflects reproductive function reduction. Have you not noticed, practically, when you look at those competitions where you see those guys, who have seen those guys? I don't know what they call that competition, where they put some kind of oily stuff on their body, their muscles are shiny, and they are there lifting weight, or they are doing like this. I don't know what they call that competition. When you look down there, it's so as though there is really nothing there. Have you not noticed? Or is it me that is looking too much? Macho, right? Yes, macho. There's really nothing there. I mean, my eye no good. Why? Because those injectables, those steroids, while it's building muscles, is cutting down sperm production, and that level will become shrunken as though it does not exist. It gives an illusion. These anabolic steroids gives an illusion of strength, right? You know, women love V-chest a lot. So while you're loving V-chest, you want to ask yourself, this V-chest, what does it translate down there, right? It gives an illusion of strength. And that is one of the most misleading aspects of steroids. The most misleading aspect of steroid use is that illusion of strength. Because a man may feel stronger. Good evening, Maya is here. Hello, Maya, good to see you. Gaga, calm down. Don't be conceive. You go conceive, don't worry. Right? You conceive. Just get knowledge first. Hello, Nyasha is here. How are you? Good to see you. So if you are trying to conceive, you need to be patient. You need to be patient. You need to be educated. And you need to comply with what we are telling you. Otherwise, you are just wasting your time. All right? So for today, we are talking about gym steroids and fertility. Tap on your screen, share the live. You know, if you don't tap on your screen, if you don't share the live, TikTok gets the illusion that people don't like what we are teaching. But when you are tapping on your screen, share the live, you drop a rose. TikTok say, hey, they love this thing. They will bring more people, right? So that's what we want. And sometimes I wish I can do only subscribers, but there's no provision for that on TikTok right now. Right? So let's tap on our screen, share the live. And once in a while, drop a heart me, drop a rose. That's what helped the live stream, because that's what TikTok counts as impactful live stream. But if you're just watching, enjoying for yourself, I'll collect my knowledge back. All right. So I said these anabolic steroids give the illusion of strength. And that is one of the most misleading aspects of steroid. Misleading. Because a man may feel more energetic, a man may feel stronger, or even more sexually active. But internally, this is what is going on. Natural testosterone production is suppressed. Yeah? Sperm production reduced or cut off. So the outward performance that you see in the six packs, biceps, and V chest does not reflect the internal fertility. It doesn't. It doesn't. In other words, they don't get level, right? Because steroid use disrupts hormonal balance. It does. So, because it disrupts hormonal balance, this is what happens. This is what begins to happen. There's going to be increase in estrogen. Estrogen is more of a female hormone. But now the levels, of course, there is estrogen in man, but in a minimal level. So when there's a disruption like that, estrogen level begins to increase in man. So what was supposed to be testosterone is now converted into estrogen. And this can lead to issues like hormonal imbalance, breast tissue development. You see, man, they get breasts, right? We call it gynecomastia. You see, man, they gather breasts. Not be here. Right? And there's even more, a further, when testosterone or rather estrogen level goes up, there's further suppression of sperm production. So the man internally is becoming a woman. Right? That's what anabolic steroid will do. It also will reduce natural recovery. Right? What does that mean? It means that over time, the body may struggle to restart its own hormone production. The body knows how to adapt. But when you keep on attacking it with steroids, over time, it begins to struggle to restart itself. Right? It will struggle. So you want to be careful. Now, having said all that, what is the impact of this on pregnancy? Of course, it's obvious. The effects are direct and very significant. And the effect of that will mean that there will be absent sperm or even reduced sperm. And without sperm, natural conception is not possible. Natural conception is not possible. How many of those machos that you know had kids while they were in that occupation? Or maybe the WWE guys that use those things. While they were in the occupation, how many of them had kids? You'll be shocked. So that's the first thing that happened. No sperm production, zero. You have muscles, but no sperm. Testis is shrunken. Right? The second thing that can happen is that Adama K. I see you. Thank you for the follow. right? Queen G, thank you. Is it GE? Queen GE, thank you for the likes. So the next thing that can happen is there's going to be delay recovery. Recovery. Remember, we said that everything, or rather, most of the infertility cases in men, right, are reversible. So when they eventually stop using the anabolic steroids, there's going to be delay recovery. Even after you stop it, sperm production may take time. May take, for some, the quickest is 3 to 6 months before it recovers production again. Sometimes longer. Sometimes longer. So that's what it does. So delay recovery. Right? There's also the psychological effect. Remember, everything fertility starts here. It all starts here. So because of the hormonal fluctuations, right? Mood swing will be noticed. Don't you notice they're always angry? Angry people. They're either hungry or sad. This is the two major mood swings you find. Either angry or sad. Right? That's the psychological effect. And also, it's going to affect their libido. Praise. That may just be menopause, So we want to check it out. Another psychological effect is it can affect libido. Remember, libido starts from here. It's not down there. Libido starts from here. So the urge to want to knock is affected. And ultimately it will affect sexual performance. From the beginning, it may look like they are getting it all right. But by the time the steroids is done with them, even the knack, they're not going to see knack. Why? Because John Thomas will not erect. All right, please tap on your screen, share the live. You took, and so if you are using family planning, why are you asking for, you are the one now, you are the cause of it now. Stop family planning. When your body recover, then you try to conceive. Praise the Lord. You're asking for too much, and yet you are the one standing as a stumbling block. Follow me. You are not following me. Right? You are not following me. Follow me now. If you are still here, please type in the comment section, I'm here, so that I know that you are there. I know you are learning something. So the next time you are falling for jelly, you are jelly. Good to see you. You're welcome. Are you following me yet? Jelly Gelly. You're welcome. All right. Please come up and ask your questions when we're done. Is that okay? So I want to advise you. Gaga, how to conceive. Don't worry. Small thing. It's not pregnancy. Go carry out. So long as you're not the one doing yourself. Jelly Gelly. That's all we're answering. So you don't want to miss the live stream. Monday to Friday, 8 p.m. Nigerian time. Alright? So let's go back to the gist. I know that the network is now slow and all that, but calm down, we'll finish it. So I was saying that I wanted to look at some facts about steroids and fertility. Right? That's what I wanted to look at. First of all, Not all the users of these steroids realize what they are doing to themselves. Not all of them do. They don't realize because they are never informed. They are never informed that these steroids that is making your muscle big, you are looking all macho, can temporarily or prolong infertility. So if you are married to somebody in macho competition, or he loves doing this macho thing and he's taking steroids, you want to ask the person to stop now. You want to stop now because you are doing something to your fertility that is unimaginable. So that's the first fact that they don't realize. They don't realize the risk because they don't tell them. The same thing some of you do in your fertility journey. You're just wasting your time and money. But I'm here to tell you. Is that okay? Also, a significant number of men that present with low sperm or absent sperm, they already have a history of the use of, that is for those who come to the clinic. So that's why medics will have to do due diligence to find out their history, because some of them are already using anabolic steroids. Already. They already do. And even when you stop, I hope you realize that recovery is not always immediately. Because that's what a lot of people do. They always expect that, this is the problem, I stop it, tomorrow I get result. It does not work like that. Dynamics me. You're dynamic me? Good to see you. You're welcome. I'll follow you back later. For some men, even after they stop it, they will need treatment for them to be able to restart sperm production because of the damage they've already done to their testes. RCHP radical. You're welcome. I see. Even when they stop it, they will need treatment because they've done serious damage. Serious damage. Thank you for the follow, Queen GE. They will need treatment. I tell you, it's not enough to have V chest. Some of us have one pack, but we are not looking for two packs. The one pack is enough. So why? Because as you are building muscles, and you're drugs to build the muscles, remember that you are damaging your ability to produce sperm. Sperm and to build muscles. What are you looking for? R Fuji, I see you. Thank you for following. Is that okay? But question still remains. And the good news is, can fertility be restored in such individuals? Yes. In many cases, yes. But it's not quickly. It's not quickly. So such people, when they stop it, we need to give them time, 3 to 6 months to recover. Many of whom will recover. For those who don't, give them some more time to recover. For some others, they may need treatment to recover. You understand? This is what happens, right, when it comes to recovery. The restarting of the hormonal signals is very slow. And because it's slow, sperm production also will take some time to start. But it will start. But it will take several months. Those of you women that like using birth controls, is that not part of your story? You stop birth control, you're expecting your menses to start, it's not starting. You say, "Oh, doctor, what's wrong?" That's what's happening. Your body needs to to realize that you've stopped and need to restart itself. You understand? I'm going to talk about women pretty soon because you all need to know what you're doing to yourself sometimes. Many of whom don't know. But we will help you, right? We will help you. For some people who need medical support, they'll give you drugs to stimulate your hormones. God will help you, you'll recover. But remember, in your recovery journey, right? Your recovery journey, it will take time because natural sperm production is about 3 months. One sperm cell to be produced 3 months. And you have stopped it for a very long time. So you need to, recovery is not immediate. It will take time, right? So you need your hormones to normalize. You need new sperm cells to be produced from the scratch. So patience is critical. Don't stop anabolic steroids yesterday and come to me and say, oh doctor, I want to have babies tomorrow. No, sir. Yes, dynamics me, yes. The answer is yes. And I've given all those details already in the past live stream. I know you are coming for the first time. So you want to go to my YouTube channel, Dr. Godwin EMB. All the details about sperm and infertility in men for the past more than 20 something days now, they are all there. Check it out. Share it to all the men you know, because we want more men to produce precious sperm, right? Even though you don't want more babies, at least precious sperm will make the woman look fresh, like turkey, right? All right. So whether for baby or not for baby, you need them. Want to look fresh and happy, because those when they knock, they always the vex. Where was I? How did I get there? I think it was somebody asked that question. So what was I saying? So I said even when you stop the steroids, use of steroids, it will take time for your body to recover. T is here. Hello, T. Good to see you. Right? You are going to get pregnant soon. You will, certainly. Just listen to me. Is that okay? You see, so many men fall into this lifestyle trap, right? Many fall into a cycle of desire for rapid results, the use of performance-enhancing substances, which unfortunately for them, without knowing, they are suppressing their fertility. Why? Because they want a quick macho manship of V-chests, muscles all over the place. You will get it, but at the risk of your fertility, right? At the risk of your fertility. So for men who are trying to conceive, this is my advice. This is my advice. Is that Juicy Blessing? You're welcome. Juicy Blessing is here. Men who are trying to conceive. Big Mommy, I see you. Men who are trying to conceive. This is my advice to you. Please avoid non-medical steroid use. Avoid it. Especially when you are planning pregnancy. Avoid it. Right? And learn to disclose your history honestly if you want us to help you. Be honest about it. Who said give up? Don't mention that in here. Phoebe, don't try them. Give up to what? Are you sure you have been trying correctly? Don't worry, we'll teach you. You'll get results. Don't worry. Calm down. Right? So I'm advising men, learn to disclose your history honestly. If you have a history of steroid use, tell your doctor. Disclose it so that we can evaluate you correctly. right? Yeah, Gaga, you are forming a community of tiredness. I will carry my Oraimo code on all of you. No, nobody should be tired. So long as he's having a baby, you will have a baby. Is that okay? No community of tiredness is allowed here. Is that okay? And if you stop using steroids, allow your body to recover. Be patient. Before I tell you, whether you're a man or you're a woman, you are trying to conceive, prepare your body first 3 to 6 months before you attempt. Because you are just there knocking for nothing. Let me teach you how to try. Right? Let me teach you how to try. So for men who have issues, learn to seek medical help. Professional evaluation is essential. Let us know what the problem is, then we'll know how to advise you. Prepare with what? Prepare with knowledge, Gaga. Prepare with knowledge. Because most of the infertility cases around the world is ignorance. It's not really that something is there. Ignorance. Because in the end, everybody is giving you the same treatment, and no result. So doesn't that tell you something? Right? So calm down. You will be fine after we are done with you. Right? So I want to take some questions in a few minutes. But what I want to say is the body is designed with balance. The body is not a hazard. It's designed with balance. So when that balance is artificially altered using drugs or some of these contraception you people use, there are consequences. I hope you know. There are consequences when you do that. So I'm talking to men. I will leave women for now. I will talk to you guys later. So when men use anabolic drugs, steroids, there are consequences. Your muscle will build big, fast. It will. You'll get that result. But fertility will suffer. It will suffer. You need to understand that fertility requires coordination, timing, and natural regulation. And the natural part of regulation is what you have damaged. Right? You have silenced that signal. The reproduction becomes very difficult. And you begin to wonder what is really going on. But the good news is that if you would stop the anabolic injections or the oral ones you use, give yourself some time, you will recover and your fertility will be restored. Is that okay? All right. That is what I have to tell you today. That's what I have to tell you today. Right? So in the next 3 to 4 days, no, 2 to 3 days, I'll be done talking to men about infertility. Then we'll go back to women. I'll continue our journey so that by June, majority of the people who have been listening to us should be able to come back with testimony of positive pregnancies. So if you have a question you want to come up, send your request. Come and ask me question now that you can.